Hi everybody. So I'm Phil Jennings. I am the Chief Executive of the Innovation Agency, which is one of the 15 academic health science networks that make up the AHSN network. And I'd just like to spend a few moments talking about the network and its role in the health system. So if I could have the first slide, please. So there are 15 of us in total. Actually, we're 10 years old next year. And we were created to accelerate the spread of and adoption of innovation in all of its forms across the country. So that's products like what we're talking about today, but it also includes innovative medicines and actually also just new ways of working, particularly where that might involve, say, a digital technology or a new way of patients interacting with their healthcare professionals. Could I have the next slide, please? So our ambition is to improve lives through innovation. As you'd expect, the improving the health of our patients is really at the heart of what we do as an NHS organisation, although increasingly our work is moving to prevention and also tackling health inequalities. Importantly and unusually for an NHS organisation, we also support economic growth within our regions. And we have this specific remit within our license agreement. And this is really to reflect the fact that some of our biggest health challenges are rooted in the wider social determinants of health. And therefore, by leveraging growth in the health and life sciences sector, both in our regions and nationally, we can make an important contribution to the economy. And this had a positive knock-on impact in the health of our populations. Next slide, please. So we're both local and national. So as I said, we operate under these 15 local footprints. I think what's important here is that we really do understand our geographies. You'll appreciate that the health challenges in Liverpool, where I am today, compared to say London, are not always the same. And we appreciate this, but we also recognise how our local services are configured differently across the country. There may be a specialist unit in one area, or maybe an intermediate service, or a GP with a special interest, which means that we're able to tailor our approach to match those skills and expertise within our systems. And finally, we have local relationships with our health and care leaders. And this is important because by speaking with them, we're able to understand the needs of our local systems and then articulate this back to our commissioners in order to inform future programmes and policy. But equally, we use those relationships in order to spread our national programmes and products. Next slide, please. But we are also a national organisation. And in our national role, we work in a coordinated fashion across all 15 of the AHSNs. And really, we're the only vehicle within the NHS which allows the spread of a single programme or product selected nationally at scale and pace across the country. And in fact, we've just completed a significant governance review, which means that in the future, we'll be working in an even more coordinated manner for our future work. Next slide, please. And this unique local and national form really does reap benefits with our systems. So here you can see some of the highlights of our recent work. So you'll note that during COVID, AHSNs were instrumental in the establishment and the rollout of both pulse oximetry services and virtual wards. And then even despite the challenges of COVID, we still managed to benefit 500,000 patients through our products and programs and leveraged $500 million in investment into our regions, which helped to create and preserve many jobs. And next slide, please. So finally, I'd just like to finish by highlighting our list of the current set of national programs which we support, of which, of course, the MedTech funding mandate is an important part. And this represents overall about 50% of the work that we undertake, with the remainder being done in conjunction with our local systems, increasingly liaising with our emerging ICSs.